Now we will see the attachments of the hip bone in a bit more detail. We discussed the attachments on the iliac crest, so we will start with the iliac crest again. We discussed that on the outer lip of the anterior 2/3 of the iliac crest, there is an attachment of the external oblique muscle. As you can see over here, I have marked it with the marker that the anterior 2/3 of the outer lip of iliac crest gives attachment to the external oblique muscle. Now, external oblique muscle is not a small muscle, it is a huge muscle, and it has a wide area of attachment. Usually, muscles of the limbs are attached to the bones by tendons. Tendon is a small structure and it is attached to the bone where the area of attachment is not very large. In case of external oblique, as you can see, this muscle is the external oblique muscle. One of its attachment is on the hip bone. Some of the attachment origin of the muscle is from the ribs, and it has to go and get attached to a very large area, which is starting from the xiphoid process of the sternum, linea alba, and it goes down to the pubic tubercle. So it has a very wide attachment. Therefore, a tendon cannot serve the purpose. So this muscle, the tendon of this muscle gets modified and forms a large sheet which is called an aponeurosis. As you can see, this red portion is the belly of the muscle and this white portion is the aponeurosis of the external oblique muscle. In this picture you can see that this is the hip bone and you can see the iliac crest. So this thing is the outer lip of the anterior 2/3 of the iliac crest. Now we will try to see and find the iliac crest, the outer lip of iliac crest on this picture. Similarly, this portion, this is the outer lip of iliac crest. So external oblique, the belly of the muscle gets attached to the anterior 2/3 of the outer lip of iliac crest. And as it reaches the anterior superior iliac spine, here, it has no other point of attachment over here. There is a large gap. So it has to jump from here to the pubic tubercle. So here it jumps, the aponeurosis of the external oblique jumps and goes down and gets attached to the pubic tubercle somewhere over here. So the inguinal ligament basically is the lower intern portion of the aponeurosis of the external oblique muscle. It is not a true ligament. It is the lower intern portion of the aponeurosis of external oblique muscle. So this is the external oblique muscle, this is its aponeurosis, and this is the lower part of the aponeurosis. One end of the aponeurosis is attached to the anterior superior iliac spine, the other end is attached down to the pubic tubercle. So this thing, the lower part of the aponeurosis of the external oblique muscle, is called the inguinal ligament. Now, along with the inguinal ligament, I will tell you about two terms that are commonly used. One is the mid-inguinal point and the other is the midpoint of inguinal ligament. So what is the difference between the two? The midpoint of inguinal ligament, as the term indicates, it is the middle point of the inguinal ligament. So to determine the midpoint of inguinal ligament, we will just see the attachments of the inguinal ligament and take its middle point. So we all know that the external oblique aponeurosis or the inguinal ligament is attached on the hip bone to the anterior superior iliac spine and on the other end to the pubic tubercle. So we will say that a point midway between the anterior superior iliac spine and the pubic tubercle is called the midpoint of inguinal ligament. Mid-inguinal point is something different. Mid-inguinal point is the middle point of the inguinal region. So to define it, we can say that it is the point midway between the anterior superior iliac spine and the pubic symphysis, not the pubic tubercle. Let me make a diagram and explain it to you further. So this is a diagram. You can see I have drawn the pubic symphysis over here. That means this is the body of the pubis and this is the obturator foramen. And I have drawn the iliac crest over here, and this thing is the anterior superior iliac spine, and this is the anterior inferior iliac spine. Somewhere over here will be the pubic tubercle, like this. This is the pubic tubercle. So we all know that the attachment of the inguinal ligament is from the anterior superior iliac spine to the pubic tubercle. So this thing is the inguinal ligament. Now if we say we want to see the midpoint of inguinal ligament, we can simply find a point midway between the anterior superior iliac spine and the pubic tubercle. It will be somewhere over here. So this is the midpoint of inguinal ligament. Now we will draw an imaginary line to show the inguinal region. The inguinal region starts from the anterior superior iliac spine and extends up to the pubic symphysis. So it will be shown by another line. I'll show a dotted line, and it reaches the pubic symphysis. Now if we want to see the mid-inguinal point, it will be a point between the anterior superior iliac spine and the pubic symphysis. So it will be somewhere over here, as this line is longer as the line of the inguinal ligament. So that means the mid-inguinal point is a bit medial as compared to the midpoint of inguinal ligament. Both these points have their own clinical significance, and that will be discussed later. I'll just tell you that the deep inguinal ring, when we'll study about the deep inguinal ring, we'll know that the deep inguinal ring lies just behind the mid inguinal point, and the mid clavicular line is also drawn from the middle of the clavicle to the mid inguinal point. So you should know about these 2 points and what's the difference between the two, and there should be no confusion between these. So this was about the external oblique muscle. The direction of fibers of the external oblique is downwards and forwards and medially, like hands in the pocket. Now coming to the next attachment, which is the attachment of the internal oblique muscle. The internal oblique muscle, as shown with this marker, it has an attachment on the anterior 2/3 of the intermediate zone of the iliac crest, and it moves right down anteriorly to the anterior superior iliac spine. So in this diagram you can see that the external oblique muscle has been cut. This is the cut end of the external oblique, and now the muscle which is exposed is the internal oblique. So the outermost layer of the muscle is the external oblique. Once you remove the external oblique muscle, you can see the internal oblique muscle below it. Notice the fibers of the internal oblique. They are running in the opposite direction as those of the external oblique. External oblique fibers were downwards, forwards and medially, but these fibers are upwards, forwards and medially. And similarly, it also ends in an aponeurosis to get its attachment to different areas. But you can see here, this is the portion where the internal oblique muscle is attached to the intermediate zone of the iliac crest. Rest of the attachment of the internal oblique is on the inguinal ligament. But when this muscle comes here, it gets attached to the aponeurosis of the muscle which is lying deep to it, that is the transversus abdominis muscle, and both these tendons combine to form a single tendon which is called the conjoint tendon. The conjoint tendon, as we already discussed in the previous video, gets attached to the pectineal line and to the pubic crest. Now in this picture they have removed the external oblique and the internal oblique, and now you can see the third muscle, which is the third layer of the abdominal muscles. This is the transversus abdominis muscle, and as the name indicates, the fibers of this muscle are running in a transverse direction. So the external oblique upwards, external oblique downwards, internal oblique fibers are running upwards, and these the fibers of the transversus abdominis are running in a transverse direction. So similarly, this muscle also has a large aponeurosis, and it gets attached to a large area, and on the hip bone it is attached to the inner lip of the iliac crest. So if this is the hip bone, this is the iliac fossa, so this is the inner lip of the iliac crest, and this is the attachment of the transversus abdominis muscle. And when it reaches the anterior superior iliac spine, it does not have any other place to get attached to, so it will get attached to the inguinal ligament, as the internal oblique muscle got its attachment on the inguinal ligament. And I've already told you that the tendons of the transversus abdominis and the internal oblique, they then combine medially and form a tendon which is called the conjoint tendon, which eventually gets its attachment on the pectineal line. Now this is another diagram in which this is a transverse section of the body at the level of the pelvis. You can see this is the inguinal ligament. So this is the anterior superior iliac spine, and you can see all three muscles which are cut: the external oblique, the internal oblique, and the transversus abdominis muscles. Now if we follow the internal oblique muscle, you can see this is the aponeurosis of the internal oblique. Now you follow the transversus abdominis, and you can see this is the aponeurosis of transversus abdominis, and at this point both the aponeurosis of internal oblique and transversus abdominis join, and this structure is called the conjoint tendon. This is the structure which is going to get its attachment to the pectineal line. In this diagram you can see the posterior aspect of the hip bone. This is the sacrum, and this is the posterior aspect of the hip bone. That means the inner lip of the iliac crest will be on the inside. This muscle which you can see is the Quadratus lumborum, which I told you that has its attachment on the posterior part of the inner lip of iliac crest, just behind the highest point of the iliac crest. If we see on the bone, this is the inner lip of the iliac crest, and this is the highest point of the iliac crest, and just behind that highest point is the attachment of the Quadratus lumborum muscle, and below this will be the attachment of the thoracolumbar fascia, this is the fascia which will eventually cover the Quadratus lumborum muscle. This is another view, and you can clearly see that this Quadratus lumborum is having its attachment on the posterior part of the inner lip of iliac crest. Now let's discuss something about the fascia lata. Fascia lata is basically the deep fascia of the thigh, and it encloses the thigh like a sleeve. So if we want to see the attachments of the fascia lata, it has attachment superiorly and it has attachment inferiorly. As it covers the thigh, so it will be attached to all the margins from where the thigh is taking its origin from. The thigh is basically taking its origin from the outer aspect of the hip bone. As you can see here, the femur is attached here and it goes down, and all the thigh muscles, everything is attached on the outside of the hip bone. So the attachment of fascia lata should be all around the hip bone. So let's see where the fascia lata is attached on the hip bone. Starting from the iliac crest, it will be attached on the whole extent of the iliac crest. As it reaches the anterior superior iliac spine, it will then get attached to the inguinal ligament. It will go down, it will reach the pubic tubercle, it will be attached to the pubic tubercle, then the pubic crest, then the pubic symphysis. Then comes the pubic arch or the conjoint ischiopubic ramus. So the fascia lata starts from the iliac crest. The posterior aspect of the iliac crest goes all the way up to the anterior superior iliac spine. Here, as the inguinal ligament is started, the fascia lata will get attached to the inguinal ligament and will go to the other end where the inguinal ligament ends. That is the pubic tubercle. It will reach the pubic tubercle. From here, it will reach the pubic crest. Then from the pubic crest, it will reach the pubic symphysis. Then from the pubic symphysis it will reach the conjoint ischiopubic ramus inferiorly. Coming back, it will reach the ischial tuberosity, and on the ischial tuberosity is a ligament which is called the sacrotuberous ligament, which runs between the sacrum and the tuberosity, ischial tuberosity. Here you can see this is the sacrotuberous ligament. So from the ischial tuberosity, it will run onto the sacrotuberous ligament and it will come back over here. Fascia lata will come from the posterior part, posterior superior iliac spine. It will be attached to the whole extent of the iliac crest. It will reach the anterior superior iliac spine. From the anterior superior iliac spine, it will jump along with inguinal. It will be attached to the inguinal ligament and it will reach the pubic tubercle. From the pubic tubercle, it will be attached to the pubic crest, to the pubic symphysis. It will come down and will be attached to the conjoint ischiopubic ramus. It will go back and it will be attached to the ischial tuberosity. From the ischial tuberosity, it will run upwards on the sacrotuberous ligament and it will reach its starting point, that was the posterior superior iliac spine. So that forms almost a complete circle. In this way, it will enclose the thigh completely. Now in this diagram, you can see a modification of the fascia lata. This modification is on the lateral side of the thigh. This white structure, this is called the iliotibial tract. So it will start from the ilium and it will go all the way down to the tibia. It gives attachment to two muscles. One is the tensor fascia lata and the other is the gluteus maximus. In this diagram, you can see both the muscles. This is the tensor fascia lata, which is attached to the iliac tubercle. This portion is the iliac tubercle, and this attachment which I have shown, this is the attachment of the tensor fascia lata. This was the attachment of the gluteus maximus behind the posterior gluteal line and on the outer slope of the posterior 1/3 of iliac crest. This muscle also takes its origin from the sacrum. Now in this diagram, we are looking at the posterior aspect of the pelvis. You can see the sacrum, and this is the iliac crest, and this is the portion of the posterior 1/3 of iliac crest. So you can see that the gluteus maximus, which is this muscle, is taking its origin from the posterior 1/3 of the iliac crest and from the posterior part of the lateral surface of the ilium behind the posterior gluteal line, which is obscured by this muscle at this moment. The rest of the muscle takes its origin from the sacrum. This muscle goes downwards and laterally like a flap, and it covers all the muscles, rest of the muscles of the gluteal region, and it will get its attachment to the iliotibial tract along with the tensor fascia lata. Here you can see the lateral aspect of this muscle, which is taking its insertion, which is getting inserted into the iliotibial tract. This iliotibial tract is named because it starts from the ilium and goes down to the tibia, and this muscle is the tensor fascia lata. As the name indicates, it is the tensor of the fascia lata. As the iliotibial tract is a part of the fascia lata, so the tensor fascia lata is going to keep this thing tense. So it is so called the tensor fascia lata. Now next comes the attachment of the gluteus medius. This is the attachment of gluteus medius. This gluteus medius is attached on the gluteal surface of the ilium, that is the lateral surface of ilium, between the posterior gluteal line and the anterior gluteal line. So we will see its image. So in this diagram we can see that this is the gluteus maximus and this is the gluteus medius muscle. On the right side, they have removed the gluteus maximus and the gluteus medius. Gluteus maximus gets removed from here, from the sacrum and from the outer slope of the iliac crest, plus the area behind the posterior gluteal line. This is the posterior gluteal line. Gluteus medius has been removed from the area between the posterior gluteal line and the anterior gluteal line. So this was the attachment of gluteus medius which you can see here. After removing the gluteus medius, you can see the gluteus minimus, which takes its origin from an area of the lateral surface of the ilium below the anterior gluteal line and between the anterior and the inferior gluteal lines. So this is the gluteus maximus, this is the gluteus medius, and this is the gluteus minimus. And on the bone you can see this is the attachment of gluteus maximus behind the posterior gluteal line. This is the attachment of gluteus medius between the posterior gluteal line and the anterior gluteal line. And this is the attachment of gluteus minimus between the anterior gluteal line and the inferior gluteal line. Now the inner slope of the posterior 1/3 of iliac crest gives attachment to the erector spinae muscle, this muscle. The erector spinae, as the name indicates, is the erector of the spine, and this is not a single muscle. It has different parts, as you can see over here. The part which is attached to the hip bone on the inner slope of the posterior 1/3 of iliac crest is called the iliocostalis, the iliocostalis part of the erector spinae muscle. As the name indicates, it starts from the ilium and it goes to the costae. Costae means ribs. So this is the part of the erector spinae which is called iliocostalis, and it is attached to the inner slope of the posterior 1/3 of iliac crest. Now here you can see the iliac fossa and the attachment of the iliacus on the iliac fossa. We will see a diagram which shows the muscle in the body. This is a diagram showing the origin of the iliacus muscle from the iliac fossa of the ilium, and this muscle comes down and runs deep to the inguinal ligament along with another muscle which is called the psoas major muscle, which takes its origin from the vertebrae. The psoas major and iliacus both join their tendons to form a conjoined common tendon which is called the iliopsoas, and it gets attached to the lesser trochanter of the femur. So this is the iliacus muscle, and the fascia which covers the iliacus also takes its origin from the inner lip of the iliac crest, and it will cover the whole of the iliacus and it will come down into the thigh. And we have discussed the attachment of the rectus femoris. I told you the rectus means erect and femoris is related to the femur. So it is the straight muscle which runs on the anterior aspect of the femur. It has two heads, and both of them take origin from the hip bone. One takes its origin from the anterior inferior iliac spine. The other origin is from the reflected head. The straight head arises from the anterior inferior iliac spine, and the reflected head takes its origin from the area above the acetabulum and below the inferior gluteal line. So here you can see the rectus femoris muscle. This muscle is the rectus femoris. It runs on the anterior aspect of the thigh, and it is you can see the origin from the anterior inferior iliac spine, but the other origin is obscured in this view. Now this is the inner aspect of the pelvic surface of the ischium and pubis and the ilium, and you can see this is the origin of the obturator internus muscle. This here, from the lesser sciatic notch, upper margin of the lesser sciatic notch below the ischial spine, is the origin of the gemellus superior, and at the lower margin of the lesser sciatic notch is the origin of the gemellus inferior. From the posterior inferior iliac spine and the pelvic surface of the ilium, you can see this is the attachment of the piriformis. Some of its attachment is on the ilium and the rest of its attachment is on the sacrum. And if we come on the lateral aspect, you can see that on the lateral, just anterior to the lateral margin of the ischial tuberosity, you can see this attachment, which is the attachment of the quadratus femoris muscle. Now we will see all these muscles in a diagram. This is a diagram showing the posterior aspect of the pelvis. This is the sacrum, this is the hip bone, this is the greater sciatic notch, this is the ischial spine, and this area will be the area of the lesser sciatic notch. This muscle is the obturator internus, which you can see is covering the obturator foramen and is attached on the obturator membrane and to the conjoint ischiopelvic ramus and the pelvic surface of the pubis and the ischium. Its tendon moves backwards and laterally. It passes through the lesser sciatic notch and goes laterally to get its attachment on the greater trochanter of the femur. Now this is the upper margin of the lesser sciatic notch, giving the origin to the gemellus superior, which is running along the tendon of the obturator internus, and below the at the lower margin of the lesser sciatic notch you can see the origin of the gemellus inferior, which is running on the inferior aspect of the tendon of the obturator internus. Now this muscle is the piriformis. The piriformis takes its origin from the posterior inferior iliac spine. This is the posterior superior iliac spine, and this portion is the posterior inferior iliac spine, and this is the pelvic surface of the ilium from where this muscle takes its origin, and rest of the muscle, as I already told you, is coming from the sacrum. It will pass through the greater sciatic notch and will reach the greater trochanter of the femur and will get its attachment there. This muscle here is a quadrangular muscle which is called the quadratus femoris. It arises from the anterior part of the lateral margin of the ischial tuberosity, and it runs laterally and gets its attachment on the femur. Here is another diagram showing all those attachments again, in which you can see the obturator internus, the gemellus superior, the gemellus inferior, the piriformis, and the quadratus femoris muscle. Now the obturator externus muscle takes its origin from the margins of the obturator foramen on the lateral aspect. This I have marked the origin of the obturator externus, and rest of its origin is from the obturator membrane. In this diagram you can see the origin of the obturator externus from the outer aspect of the obturator membrane and the margins of the obturator foramen, and it runs behind the neck of the femur to get its attachment on the greater trochanter of the femur. Now coming to the outer aspect of the conjoint ischiopelvic ramus, you can see the attachment of the adductor longus from the angle between the pubic crest and the pubic symphysis. This is the attachment of the gracilis. This is the attachment of adductor brevis, and this is the attachment of adductor magnus, which runs all the way back to the lower and outer quadrant of the ischial tuberosity. Now we will see all these muscles in a diagram. This is the anterior part of the thigh, and we can see all the muscles here. In this diagram you can see this muscle is the pectineus, which takes its origin from the pectineal line and the superior surface or the pectineal surface of the pubis. This is the pectineal line, and this is the pectineal surface of the superior ramus of pubis, which lies between the pectineal line and the obturator crest. So this muscle takes its origin from here and it goes down to get its attachment on the femur. This is the origin of the adductor longus from the angle between the pubic crest and the pubic symphysis, and it runs down and is gets attached to the femur. Now on the right side you can see that adductor longus has been removed. After the removal of adductor longus you can see this muscle, which is the adductor brevis, which takes its origin from the conjoint ischiopelvic ramus, and below the adductor brevis is the adductor magnus, which takes its origin from the conjoint ischiopelvic ramus and the lower outer quadrant of the ischial tuberosity. Now this is the ischial tuberosity, and you can see that this is the upper part of the ischial tuberosity, which is divided into two parts, the supralateral part and the inframedial part, by a ridge. The supralateral part gives origin to the semimembranosus, which is a part of the hamstring muscles, of the muscles of the back of the thigh. And the inframedial part gives origin to two muscles, which is the semitendinosus and the long head of the biceps femoris muscle. Here we can see the hamstring muscles taking their origin from the ischial tuberosity. This is the biceps femoris, this is the semitendinosus, and this muscle here is the semimembranosus muscle. Now, one thing which I forgot to mention with the inguinal ligament is the lacunar ligament. What is the lacunar ligament? As the inguinal ligament comes from the anterior superior iliac spine and reaches the pubic tubercle, an extension of this ligament, which is called the lacunar ligament, runs backwards onto the pectineal line. It has a sharp semilunar margin, that's why it's given the name lacunar ligament. An extension of this lacunar ligament runs all the way on the pectineal line. This is called the ligament of Cooper, or the pectineal ligament of Cooper.